Total joint replacement specific to either hip or knee replacement focuses around removing some bone, and typically this is done for arthritis. So we remove arthritic bone and cartilage and replace this with manufactured components. Typically these are some type of surgical grade metal or surgical grade plastic or ceramics that are implanted in the place of where the bone was removed, and it's meant to allow patients to get pain relief from the arthritic bone, and it allows them to at times regain mobility and range of motion and stability in joints that have been compromised. From the patient's perspective, the surgery itself, it begins with preoperative planning. So they'll see their primary care doctor ahead of time, make sure that they're healthy enough to undergo surgery. They can have any additional tests that need to be done for their heart or lungs before that time. Here at Concord Hospital, they have a preoperative joints class that we have our patients go to so that they can learn a great deal more about joint replacement surgery and learn more about what's involved. They will have some labs drawn preoperatively, meet with the anesthesia group, and then they'll come in the day of surgery. The procedure itself takes roughly a little over an hour. It varies from person to person, sometimes a little bit longer, sometimes a little bit less. They'll have their joint replacement. They'll wake up in the recovery room, or sometimes they can be done under spinal with kind of some light sedation. But they'll go to the recovery room. We'll check an x-ray, we'll check some blood work, and then the hope and the expectation is that they'll be able to stand up that day on that hip replacement, and they will be able to take a few steps with a walker and with some help. Most people are able to do some stairs before they go home. The average length of stay would be either 1 or 2 nights for a hip replacement in the hospital. During that time, they're getting some physical therapy. They'll then go home. They'll have a visiting nurse that will check on their wound and help them with some simple mobility exercises. Return to work also varies greatly by job. There are some executives who will be in the hospital trying to get work done, and with the pain control that we hope to achieve, typically that is possible if you want to do it, but the range varies there, and for some people who have physically demanding jobs, it can be 2 months off of work before they're ready to go back. Major difference with knee surgery is that the rehabilitation on the part of the patient is increased, and so there's a kind of a limited window of time that patients have to regain that range of motion in their knee, and so they'll work on those exercises more frequently than hip patients need to, and that'll be both in the hospital and when they go home, and oftentimes with a physical therapist afterwards in a true physical therapy office setting.